The voice of truth tells me a different story. The voice of
So, welcome to your advanced healthcare class for June. And so tonight what we're going to talk about is the top 3 ways to get healthy skin and achieve healthy skin. And we're going to be talking about external factors and internal factors, and we're going to really break that down. But before I do that, I really just want to talk about some things that have kind of been up in the practice the last couple of weeks. Because, you know, one of the things that never really like clears out of my energy state is when people kind of create situations where they're not doing everything that they need to do to be successful. You get that? So sometimes, and most of the time, it's a lack of knowledge. It's not because they're trying to do anything malicious or anything like that. It's just a lack of knowledge. There's 300 different chiropractic techniques, and less than 1% of those 74,000 chiropractors are doing something called principal chiropractic, which is that they're working with brain neurology. They're working with the way the brain communicates with the spinal cord and how it sends signals from that spinal cord to the organs. Most people are doing their crack, bing, boop, bang, right? They're doing all this stuff to make you feel good, rub your tutu, but they're not really doing anything to put the neurology or get the neurology right in your body.
Temporary relief.
Absolutely. That's exactly what it is, Brian. Well put. It's temporary relief. And so your condition never goes away. And they're not doing any type of diagnostics to really get to the cause of the problem. They're not doing anything to show you before and after whether what you're doing is working. And so you just constantly go into a pattern of sickness. And so as holistic neurological chiropractors, we're looking for what we call the vertebral subluxation, which is when the bone moves out of place and it crushes a nerve. But we're also looking for cerebral spinal fluid and the flow of that from your butt bones to your head bones. Because a lack of cerebral spinal fluid to the brain will cause multiple sclerosis, early onset dementia, Parkinson's, right? Cancer, early death, all sorts of stuff. And anything that's going on or not going on in your body is a product of nerve flow, and it's a product of cerebral spinal fluid in your body. So we have to look at all those factors, right? So most of you were never taught or trained or never knew how to correct that or get to the cause of that. And so what happens is you go to this conventional mechanistic person. Maybe you go once a month, or you go when you feel like it, or you go when it feels good, and you don't go when it doesn't feel good. And that's kind of like brushing your teeth on Monday and not brushing them again until the following Monday. And you do that for like 20 years. What happens to your teeth? They're going to look like snaggletooth, right? That happens to our spine. But we kind of think out of sight, out of mind, don't we? Like if we can't see it, oh, it's not there, it's okay. And we do this program. Yeah, anybody know how great this plan is, how effective this plan is? Ask your friend that has cancer or is on 10 medications how this worked for him. And I don't mean to be like negative, I'm just being real with you. That's what happens though. So in order to enroll you in a new possibility, the type of possibility that's going to allow you to stand outside of yourself and receive the type of transformation that you need to be a better employer, employee, wife, daughter, son, whatever your roles are, hats that you put on in life, you got to protect your number one asset. And so in protecting that and getting that corrected, time and repetition is going to do that. That's the first thing I want you to know. But the second thing that you're going to encounter is something called retracing. And what retracing is kind of like unpeeling an onion. And as you start to unpeel that onion and you start to get in a state of function instead of dysfunction, like meaning we start to find the areas where there are blockages on these organs, because anywhere where we block a hose and it's got a kink, it can't get the water through. Yes or yes? For sure. And so if there's a block on the nerve going to your heart, for example, you may not feel anything. The first thing you might feel, you might hit the deck and be dead. First thing you might feel is nothing. You're gone. And how many people do we know like that? And there's people that we read every day in the obituary section that have that going on. So that's why every month that we have this class, I want you and your family members and your friends to be here and get here. It's not for me. It's for them. Because if we can plant a seed in their heart and they change one thing about their health and that prevents them from getting cancer, now you're a lifesaver. You just saved their life. And that's a legacy, guys. That's a legacy. It's not how much money you have. It's not what car you drive, what house you live in, what pair of sunglasses you have. It's how many people did you affect positively and through love, and how many people's lives did you save? That's what it's all about. That influences whether you age quickly or slowly. And some of you are thinking about your best friend or somebody in your family, right? And their face looks like a burlap sack because they smoked for like 40 years. Like, seriously. And we love them to death, right? But you're like, darn, girl, you're looking rough. And you don't tell them that. You tell them they look good, right? Of course. But inside you're thinking, man, you're 61. You look like you're 91. So don't you think if I've been dysfunctioning most of my life more than healthy, and I've got 20, 40, 60 years of degeneration in my spine and in and around my cord, and I've never had a holistic neurological chiropractor check that, don't you think that I'll probably get sore? And so if that soreness happens, is that a bad thing or a good thing? Yeah, it's a good thing. I always tell you guys, and you guys think I'm just trying to kiss your butt in the moment, right? But soreness means things are changing. It's a positive thing. Soreness is great. I'm like, you guys are like, I got this radiating stuff. It's hurting and it hurts here. I'm like, yes. And I literally say that. How many people heard me say that? Oh, I'm so excited for you. Really, some of you want to probably slap me in the face, right? But the reason why I'm doing that is because it's totally true. Things are moving and they're starting to get better. And then the next thing I'm going to tell you is let's focus on what's working. Like one time I said to somebody, I said, how's your big toe? How's your big toe? They were complaining on the table about a bunch of stuff, right? And I said, how's your big toe right now? Doc, my big toe is fine. I said, yeah, so let's focus on that. Let's focus on what's working. Let's focus on what's working. Because that negative vibration, that negative emotional stress, you're going to create more of what you don't want. Oh, I hate my job. I hate this. Oh, man, my back right here, doc. Oh, man, this is going on right here. So it just takes time and repetition to correct that. So that's the first thing I wanted to discuss was just soreness. That's a big thing I've kind of seen within the practice members. I don't like to say patient because it means to suffer in Greek. That's the big thing that I've seen with practice members lately. Some people are sore and some people are really freaked out by it. Or some people are freaked out because they're having an emotional reaction to a subluxation. Well, what are the 3 things that can block nerve function in your body? We're going to talk about all 3 of them tonight, and that's what the talk is centered around, but I'm giving you a pre-frame, okay? What are the 3 things that cause blockages and dysfunction in our body? They're up here. So stress, what types of stresses, Siege?
Well, physical, mental.
Yeah, physical, chemical, emotional. All 3 of those stresses. But most people, they're definitely good at seeing the physical, but they totally rule out these 2, don't they? And so a lot of times why you're hypersensitive and why you get sore is because your body's not able to adapt to all the emotional stresses that you're dealing with in your life. And you're running 90 to 150 all the time, and then you got your cell phone, and you're on Facebook, and you're like, oh my God, I got to text him back. Text him back. Oh, I got a friend. Add. You know, and you're doing all this stuff like playing video games on your phone, right? And I shut my phone off. You know what I do? I delete the apps. Put my phone down. Started doing that a long time ago. You know when and I don't mean to be lewd, but when you're having a bowel movement, that's the best time to check your phone. Okay? Do you want to be on Facebook? Do it when you're having a bowel movement. Seriously. That'll save you so much time in your life, depending on how many times you're on the throne, right? Hopefully it's 3 to 4 times a day. Because that's regular, and that means you don't have digestive or stomach dysfunction, which we're going to talk about that in a minute. Seriously, though, let's start thinking about this chemical and emotional stress, this physical stress. So the product of how fast or slow your results are is related to what you're doing or not doing. So if you're picking and choosing the talks you come to, and you think you wrote the book on health, because we serve about 250 to 300 people a week. You get that? So look around the room right now. You get that? So somebody was picking and choosing the topic. Why am I touching on this? Because it's important, guys. It's important. And to the new folks that are here, God bless you. To the folks that brought somebody tonight, God bless you, because you're a lifesaver. Something that your friend or family member or coworker is going to take from tonight is going to bless them, and they're going to pass that on to somebody else. Hopefully they'll share this video too. Because you never know how far-reaching what you think, say, or do, and the impact of that has on one person or millions of people in the world, and how that has a ripple effect. And what if you were the one that co-created that, and you created somebody's healing because you did that? And that's taking a stand for somebody. That's taking a stand for somebody. That's what true love is. Love for humanity. You get that? So for my new people, does your brainstem control some things or all things in your body? Yeah. So your brainstem controls everything. Yeah, your brainstem's right here under your earlobes, guys. And that controls everything. So even if you're under the weather or something's going on, wouldn't it make sense that we would want this to work right and work correctly? And how do we know if it's working correctly? Well, we got to evaluate it, right? So when you get on the table, we're checking your legs. When you're face down and you're face up, I'm not playing footsie with you. I'm not a feet guy, right? Some of you probably don't like feet either, right? But I check your feet because your feet give me a window into what your neurology's doing. Does that make sense? So your brainstem is right by your cerebellum, right here. You're like, Sarah, what? But your cerebellum deals with proprioception. So it's the reason all of us can like balance and walk and not like fall on ourselves or trip. So when I check your legs, then you'll usually see me press in an area up by your brainstem. When I go back to your legs, guess what? Your legs are balanced when we find the correct subluxation. But what do we have to do also? Well, we have to look at films, advanced biostructural digital x-rays, which we take 4 views of you while you're here, and then every 3 months we're checking in. Why is that? Because we got to see we have to see progress and change. And I want to hold you accountable for what you're doing or not doing. You're supposed to do some of the emotional release protocols, like the breathing and stuff. 49 breaths for my new people is what you have to reach to go from a beta state to an alpha state. What does that mean, Doc? That sounds really fancy, and you sound like you really know what you're talking about, but I don't know what that means. So beta state is you're in the woods, you're running from a bear's trying to kill you. Anybody think a bear trying to kill him would make him a little anxious? Yeah, I think so, right? So that's called sympathetic stress, fight or flight. I mean, this is what happens to us, though. We're like entrenched in that. And so if you're in fight or flight all the time, a lot of you are in fight or flight and you don't know it. Can that affect brainstem health? Yes. Can that lower your immunity? Yes. Are you going to succumb to coughs, colds, migraines, headaches, digestive dysfunction? All that is abnormal. Some of us, you know what somebody tells me when I'm out at events? You guys will love this. I absolutely love it. Oh, Doc, it's just a normal headache. And I want to do, I want to do the Scooby-Doo look again on them, right? It's like, what are you talking about? A normal headache. Oh, don't worry about it. I just have normal cancer. What are you talking about? There's no such thing, a normal headache. It's normal to you because you've had it for 10 years. You get that? So if you've been subluxated for 10 years and had that much dysfunction in your body, where the body wasn't working right and your brain was in inflammation, and you've had migraines or fibromyalgia, guys, there's 18,000 conditions out there. These are just names. None of the names identify the cause. They're just names. They label you. They put you restricted and in false evidence appearing real. And then the medical doctor that basically has a direct line to Jesus and he determines when you live or die. I'm being sarcastic, of course. But that's what they think. Oh, you got 5 months to live. Well, how do you know that? How do you know that? Because there's a wisdom in your body that runs your body. Do we operate off of science in this office? Yeah, look at all the racks. I got research. I'm not hiding it in my closet over the drugs that they tested over on rats and stuff and monkeys for 3 months. Anybody think that your physiology is the same as a monkey's or a rat's? Probably not. And you didn't. That's free tidbit. You didn't even have to pay 400 grand for that, right? It's a free tidbit. You don't have to go to school to 10 years. No, monkey and me, rat and me, probably not the same. I'm just saying. So we start having this conversation and we start thinking about a lack of brain health. We got to look at the brainstem. So if you're not neurologically getting corrected, chiropractically getting corrected, you're going to have skin dysfunction and liver dysfunction. You got an issue with your tissue. You got an issue with your tissue. Well, Doc, I don't see anything. I don't drink, Doc. Does anybody think that you can have liver dysfunction and have never tasted a drop of alcohol? How many people think that? Absolutely. That's a big, big misconception out there. Because your liver does what? It detoxifies your body. And what typically happens is if someone has a liver dysfunction, they also have a stomach dysfunction and an adrenal dysfunction. So you guys have heard me talk about this before, but when we talk liver dysfunction in the body, what we're talking is the stomach, we're talking the liver, and we're talking the adrenals. Now, when we talked fight or flight, And I'm going to show you the connection. This is going to all come back together and make sense. Okay, just stay with me. So adrenals, if you're in fight or flight, your adrenals are all whacked out. This is an organ that sits above your kidneys. Okay, that's an organ that sits above your kidneys. And the organ itself releases something called cortisol. You're supposed to have a certain amount of that. But if you're in fight or flight, because you have too much emotional chemical stress in your body, and that stress has accumulated for 20, 40, 60 years, do you think this is going to be compromised? Definitely. Absolutely, right? Because you can kind of think of health as a bucket. When we get too many chemical, physical, emotional stresses, if we're not getting holistically and neurologically checked, chiropractically, what's going to happen to that bucket? Does it stay empty or does it overflow? It overflows. And so what happens is you're in fight or flight from a nervous system standpoint. What does that look like? You get tired between the hours of 1 and 4. Your metabolism is slowed down. You want to eat more to get that comfort food. You can't sleep. You get restless sleep. You have nightmares. And what are other symptoms, all those things that I just named to you? What can also happen besides just adrenal fatigue in your body? Liver dysfunction. You know, when you have nightmares and restless sleep, that means your liver's in a dysfunctional state. When you get scabs on your body or you get these outward sores, that means that liver is in overflow. And so when there's liver dysfunction, we're not only going to have adrenal dysfunction, but we're also going to have a digestive issue. What does a digestive issue look like? Well, that would be constipation, that would be gastric reflux, that would be bloating, okay? Oh, doc, don't worry about it. I'm regular. I go one time per day. Some people tell me, I skip days. It's no big deal. It's normal. Seriously? Are you asking me or telling me? That's what I usually tell people. Are you asking me or telling me? And it's not because the person's like being mean or that they're egotistical. They just don't know. Nobody's ever told them the truth. You get that? Nobody's ever told them the truth. So it can go in any order. We can start here. We can go to liver dysfunction. We can go to digestive dysfunction. Or we can start with digestive dysfunction. Now, do you think a lack of cortisol in my body, or too much cortisol in my body, and I'm in fight or flight because I hate my boss, I'm stressed out at work, I've got a bad boyfriend, or maybe I was abused when I was a kid. Maybe I have a low self-esteem. Do you think that can cause digestive issues? Can stress cause, it's called general adaptation syndrome. Research from the 1950s, Dr. Hans Selye, talked about the emotional thought processes that we do or we don't have consciously and subconsciously, and the effects on our digestive tract and digestive system. And I've got a bunch of research right here. This just isn't fun papers that I brought up here, right? And one of the research articles, and it's not Wikipedia and Google. You ever notice how people think that's research? It's so funny. Oh, I found it on Wikipedia, doc. It says this. I'm like, yeah, I'd be a little skeptical about that. Wikipedia is not a valid source. That's somebody's opinion. It's just like Google. But when you find white paper peer-reviewed research where they had sample sizes, they had control groups, and doctors and scientists from all different fields are analyzing how the study was conducted and what was done on it, that's valid research. And so the research that I was looking at, it said that leaky gut caused from emotional stress, which leaky gut is when your body's not breaking down the food, and that shows up in the form of bloating, gastric reflux, or acid reflux, where the acid comes up from your stomach, and constipation. But when we get the symptoms, because those all would be like late-stage alarms. Anybody agree with that? Mm-hmm. Yeah. Is that the first time that your car, meaning your body, had that problem? No. That's just the first time you noticed it. But that bucket was filling up the entire time. You get that? That bucket was filling up for a long, long time before that. So you're in overflow by the time you notice that you're constipated, you have gastric reflux, or you have bloating. Or even if we scanned your body, we have a thermal scan that we do, right? Where what it does is we run it over your nerves and we run it over the spinal cord, and it picks up heat readings left and right bilaterally, okay? And what it shows us is it shows us any time that nerve is being blocked going to that organ. Looks like that. And then we take 4 views in and around the spinal cord to see anatomically. So we want to match up the anatomy, the hard bones crushing the soft nerve, and we want to match up the physiology and see where the blockages are. So don't you think that dysfunction in the stomach or leaky gut where I'm not assimilating my minerals, wouldn't it make sense that that nerve in my lower back that goes to the muscle in my lower back is going to cause dysfunction in my stomach, but then in the late stages I'll feel lower back pain? Does anybody see that correlation there? Yeah, because there's a huge one. It's in all the research out there. It's in all the research out there. So we got stomach issues, and so what the body starts to do, if it can't break down the food, the minerals are not staying in the cells. The body's not able to package and deliver those minerals and those nutrients to the cellular tissue that it needs to regenerate your cells in your body. And that's called leaky gut. That's basically what it means. All the minerals and vitamins that you need when you eat, because your body, your nervous system's like a factory, especially the digestive system. Even if you eat a doggone Twinkie, it magnificently can break down that Twinkie and take what little bit of good there is and make a healthy liver and heart out of it. Make new tissue cells, heart cells, lung cells. But what happens is the food that it doesn't break down because you're emotionally stressed or you have brain dysfunction up by your brainstem, the food it doesn't break down ferments. And then what organ is going to bail out the stomach to detoxify the stomach? The liver. And so what eventually happens, so we can go from here to here, is do you think eventually the adrenals, like if the liver's having to work overtime and it wasn't designed to do that, because I got a dysfunctional organ up here, eventually is this organ going to be compromised? Yeah. And then you start getting fatigue. And so what happens? Well, now you got gastric reflux, you got bloating, you got constipation, you got scaly skin, you got an issue with your tissue, because your skin is a mirror to what your liver is or isn't doing. Does that make sense? It's a mirror to what your liver is or isn't doing. So obviously I want to make sure the brainstem, because there's a connection here between the brain and the body and the organs. So I want to check you head to toe to make sure this neurology is working right. And after that neurology gets going, because most of you when you come in here, you got 20, 40, 60 years of stuff, then doesn't it make sense that we want to actually look at the organ itself for chemical stresses that are in that organ? Because if I just do a blood test, is the blood test measuring for dysfunction or disease? Yeah, it's measuring for disease. You get that? It's measuring for disease. So you can go and do a blood test. I mean, we see people all the time that come in here and they had a blood test done by a medical doctor. And I'm not saying medical doctors are bad. There's a time and a place for it. But we've replaced what was designed to be emergency room care, and we've made it into like a way of life. Like they manage conditions. They don't get to the cause. So if you go to a disease manager and you're expecting to rebuild your health, that's scary. Because all they're going to do is do what they do in Alabama. They're going to put duct tape on it. I think duct tape works for everything. I'm from Alabama, so I can say that, right? So yeah, they use duct tape. What's duct tape? A surgery or a what? Yeah, a drug. A surgery or a drug.
Or burn.
Yeah, they'll burn it, poison it, they'll do something to it, right? So all that stuff creates dysfunction, but if we can get to the cause, then that organ neurologically is going to be able to function better. And now what we'll do is we'll look at, from a functional standpoint, what is it getting too much of or not enough of? And that's when we'll need to do a chemical analysis of it. So some of you in this room have had that done. Some of you haven't had it done. So we talked about brain dysfunction. We're talking about liver dysfunction right now. Obviously, neurologically, I want the brain to be able to communicate with the liver, the stomach, and the adrenals. But now we got to look at what support do I need for that organ? Because how many people nutritionally think that they're getting all the food that they possibly need for the organs in their body? And our food was great tonight, right? Sponsored by O-Juice. Amazing, right? Which I love, Taryn. I love that crew over there, right? And I eat more plants than I do meat, But I'm a big believer that everybody's body is different and needs different things. But I universally believe everybody needs more portions of plants than they do meat. Needs to be 3-to-1. And I'm going to connect this in a second. But a lot of people think if you just eat right, that that's like the panacea. How many people know somebody that technically eats right and they have sores all over their body or dysfunction in their body and they're not healthy? Yeah. 4 people, right? Out of what, 15 or whatever we got here tonight, right? That's what happens, seriously. They think they're healthy because they're eating right. Well, what are they getting from a nutritional standpoint? Are they getting the nutrients out of the food, the same nutrients they did 50 years ago? No. And then here's what usually happens too. Is the nerve going to the stomach able to assimilate those nutrients? No. So they're eating all this good food, but the body's not breaking it down. The body's not assimilating it. So it can't make new tissues and new cells. So they're in dysfunction. And dysfunction is a precursor to what? Ease or disease? So I could do a blood test on them, but if it's not measuring disease and it's not there, what am I going to tell you? I'm going to tell you you're what? Healthy? Yeah, you're healthy. Oh, don't worry about it. But doc, my hair's falling out and I got fingernails that are falling out and I got rashes all over my skin. Oh, you're good. Don't worry about it. Or here's an antibiotic. And does that get to the cause or treat the effect? Treats the effect. And so this is what we find with people. So the next thing that we need to do is check for what are you getting too much of or not enough of. But I can't just go to just the liver when I'm talking about, when I'm having a conversation about your skin. Do you see why now, guys? I can't just talk about the liver. Liver function's huge, but the tie-in on my second point, because what did we say? We said the first one, what's your brainstem doing? Brainstem function. The second one is liver function. But this is, I hate to sound like Elton John, but that's the circle of life right there. It really is. That's the circle of life. Start thinking about Mufasa and all that, right? Start thinking about Mufasa. Such a cute cartoon, isn't it? So liver function, adrenal function, stomach function. And so what we're going to look at is we're going to do a survey on you, a system survey, in the next phase of care, third phase of care, it depends on where you are, to see where you are. Some of you might not, you might be sitting in this room, doc, I never had that done. Or you might be taking the easy pass and you're on Facebook. Bad. You might be taking the easy pass and you're on Facebook right now. And you're like, doc, you've never done that to me. You never told me that. Because you weren't ready for it. If the neurology's not working right, why am I going to do a chemical analysis on what you need or don't need? Your body's not ready yet. Does that make sense? But what I'm getting at is you can't get it from just food. Because you're getting 50% less nutrients in your food than you did 50 years ago. And then if your nerve going to your stomach, your liver, and your adrenals is subluxated, it's being crushed and it's in a dysfunctional state, your body's not a Maserati, it's a Pinto. Right? It's a Pinto. And I can put all the good stuff in, but the body's still not going to be able to assimilate it. That's like the Toyota Corolla you see out there with rims on it. Well, not even a Toyota Corolla. It's usually like a car that's like 15 years old, right? But they invested like 10 grand into the rims. And I used to be that guy when I was in the Marine Corps, by the way. I was that guy, okay? I was that guy. I was, and I thought I was so cool. And that Honda Civic EX probably went 0 to 60 in like 20 minutes, okay? It probably did. It definitely did, but I thought I was so cool. And it had the exhaust on it and everything. And I put all these bells and whistles on it, but the system wasn't functioning the way it was designed to. So it was still a Pinto. And the analogy is the same here. I could have put rocket fuel into that system. It would still be a Pinto because the inner wiring wasn't working correctly. Your bodies are the same way. If the inner wiring is not working right and you're putting all this good organic food in and you're a vegetarian and you're doing a downward dog and a backward cow and you rub Bragg's apple cider vinegar on your forehead only 3 times, your body's still a Pinto unless it's neurologically working. Okay? And so what we would do in the next phase of care is we would do a chemical analysis on your liver, your adrenals, your stomach. And actually we would do it on your entire body. But the first thing that I'm going to look at is what's going on with the adrenals, the liver, and the stomach. Because it starts there and ends there. So when I talk to my functional nutritionists, who are amazing, Chris Lippe and Ted Hahn, right? When I talk to them, I'm like, hey, I got this protocol for somebody. Here's what's going on. And I get other doctors' opinions because I'm not so arrogant and egotistical to think I know everything. But I do know this. I remove subluxations first. I get the body neurologically working right so that life or the intelligence in the body can express. And then after I do that, I look chemically what's going on in those organs. What's going on in those organs? So a good product that we typically use for the adrenal glands after we get neurological function as close to 100% as possible in the second and third phase of care is a product called adrenal desiccated, andrenamin. And there's another product called adrenal complex that we look at. That would be for the adrenal glands. But what about the liver? Because here's the thing you guys don't know about the liver. When you step outside right now, those chemtrails that don't exist, and that's a conspiracy, even though the cancer rates have been going up the last 10 years, and the parabens that you have in your lotions, those words you can't pronounce that are in your toothpaste, those smells, the Glade plug-it-ins, which are neurotoxins, by the way. I'm not trying to make you paranoid where you want to go home and cry tonight, but I'm just telling you the truth, right? I'm telling you the truth. That fills up this bucket. And nobody can be perfect. I'm not saying that. But what I think always needs to happen, or excuse me, what I know always needs to happen, is just self-awareness and a self-assessment. Slip and check. That's what you always want to do in your life related to your health. Slip and check. When you become convicted about something, like those Doritos that you're eating, and you look and there's like a thing, there's all these words you can't like pronounce, and there's that many ingredients on it, that's toxic for your liver. That's toxic for your digestive system. There are dyes that are in that Dorito that are not good for you. And you can look online on healthfromwithinca.com, go to the media section, the advanced healthcare class, okay? There's a whole section of videos, and you can watch my nutrition video if you want more details about that. Most of you have never been online. There's a world of resources right there under the media section, and you have access to them. Some of them require passwords. Some of them are open to everybody. And, Doc, I haven't gotten the password. That's because you weren't ready for it. See what I mean? But there's a lot of free stuff that you can get that's on there. It's on YouTube, Vimeo, all that. I got a great, I got these amazing guys and some marketers and all sorts of stuff that get the message out because we're about saving lives. So then for the liver, we're going to look at a product called Livco, Livton, Livoplex, and AF Beta Food. We're going to look at all those. But is it possible that some people will never be on any one of those products? Yeah. Because what happens? Well, like Patty Archibald, she's been chiropractically, holistically, neurologically adjusted according to her film and her scan. And in 2 months, this is a lady that used to have bouts of rheumatoid arthritis every day, 20 out of 10 pain. She's down to 2 out of 10, and she's only had 2 bouts in 2 months. This is what happens here, guys. We see all these miracles. And if you're sitting there and you haven't gotten your miracle yet, you need to check yourself related to what you're doing or not doing, and then what your state is about your life right now. What's your state about your life? What are you manifesting right now? Are you manifesting hate and what's not working? Or are you manifesting and creating new possibilities for yourself? So when you're doing your affirmations, I'm creating the possibility of abundance, creating the possibility of life. I'm creating the possibility of being more patient, more loving, more kind. Create those possibilities. I'm creating the possibility of health. This isn't the placebo effect. Neurologically, when you get adjusted at the brainstem, we're changing that brain neurology. And what does that do? Anybody follow us on Facebook? Anybody that's here? Okay. Got a couple of people, right? It was a patient video testimonial from a lady named Joanne. Okay? And Joanne, just within 2 weeks, said that she was enrolled in a new possibility. She's like, I don't know if you would call it depression, Doc, but I really felt like I just couldn't get an edge on life. Things just weren't working for me. They just weren't working. I was down in the dumps. Is that liver dysfunction, adrenal dysfunction, digestive dysfunction? Definitely. What about Patty Archibald? Yeah, an autoimmune condition like rheumatoid arthritis, that's dysfunction in the stomach. Okay? And see, liver dysfunction goes right along with it. If you got one, you can't have one without the other, right? Can't have one without the other. If you have one, you're going to have the other. And so Joanne's basically saying on the video, like, one day you just put my brainstem in the right place, and it's like I started to feel a transformation happen. It started to function the way it was designed to. I went in the car and I cried for 20 minutes. I cried for 20 minutes. And then the next day and weeks after, Doc, she told me this probably, 2 weeks ago. But she told it to me before, 2 weeks before that. She's like, the last month has been incredible. My business is exploding. Things are getting better. This is happening. I see a new outlook. I see new possibilities. All this stuff is happening to me. So that's what I mean. We talked about emotional, Joanne. We're talking about physical and neurological and digestive with Patty Archibald. Could give you a million examples like that. But in order for you to be enrolled in a new possibility, you have to take that step forward to have the follow through and execution that it takes to start working on these things. Because it's consistency, folks. You got 20, 40, 60 years of damage. It's consistency that's going to correct that. Has anybody heard something called, or has anybody ever heard of something called a telomere? So telomeres connect to the genetic coding in your nervous system, in your body. So within your DNA strands, you have telomeres, and the telomeres are basically an indicator on how long you're going to live and how fast you're going to age. They figured that out. They found on these DNA strands that there are these telomeres from a cellular standpoint that determine how fast or slow we age and how long we're going to live. And they start out really long when we're a little boy, little girl, baby. And by the time we're like 40, and I'm 38, right? They start to get really short. Now, what makes those shorter? Smoking, diabetes, a lack of health related to our weight, cardiovascular problems, having a lack of good nutrition in our body, a lack of our body being able to appropriately assimilate nutrients in our body, stress, alcohol. I could go on and on and on. Basically, anything that we've talked about tonight or I've told you before, your shampoos, the letters, all the different words, parabens and proteoglycan and every word you can't pronounce it and you start to go like that. If you go like that and you can't pronounce it and there's 1,000 ingredients, it shouldn't be on your body or in your skin because it goes directly into your bloodstream. Does that make sense? So that creates aging. Why am I talking about this? Because if this loop is out of balance, is that going to affect telomere length? Yes. Is that then going to affect your skin? Yes. See how we're kind of coming full circle with this? Because yes, your liver's involved in keeping your skin healthy, but it's kind of all connected. Does that make sense? And I say kind of because I'm being silly. It is all connected. So I don't know about you, but I don't want that telomere length to get down to like 1 cube. And they're not even measured in cubes. Okay, I'm just making that up. I don't want it to get like a Lego, like little Cordie's Legos. I want it to stay as long as possible because when it gets to no Lego, you're dead. Does that make sense? And so when we talk about metabolic inflammation, which is what this is, when there's inflammation in your body and your body can't detoxify or deal with what's happening, then you get to critical mass, the bucket overflows, and prior to coming here, you were handling that through surgeries and taking organs out or doing medications. And you started on one medication, you thought it was going to be 3 months. You've been on it 2, 3, 5 years, 10 years. And that's why we want to get you enrolled in a new possibility, guys. I've been medication-free for 15 years, but I started out the first part of my life on 3 medications. An antidepressant, anti-anxiety medication, and a class 3 narcotic that's like cocaine called Adderall. And I was taking those, and it was emotional distress, and the emotional distress was causing me to have gastrointestinal problems as a young boy, and your stomach's your second brain, So what makes you happy? Dopamine and serotonin released from your brain. But did I have that when my stomach was off? No, because what gland was off? What other glands were off? My adrenals and my liver. So was I producing happy chemicals or a negative chemical called cortisol?
Negative.
And was that making me less depressed or more depressed?
More depressed.
You see the connection here, folks? And I'm speaking in very simple terms because everybody's at certain levels about their knowledge. So I kind of have to do that. I can't get too complicated, but I like to drop little nuggets. And here's the thing. You can't hear it enough related to your life and what you do or don't do. Because some of you, your health's not your number one asset. It's your last asset when it's convenient. Had a lady today with sciatic stuff and all this, and a patient was telling me about her. She stood up at work, and this is Dave Daniels, and I told him I was going to talk about him and tell the story, right? I'm like, I hope I don't embarrass you. I call him Jimmy Buffett, because ever since he's been coming here, he's just so relaxed. The guy's just like, whatever, doc. Great to see you, buddy. Right? He's just like the happiest guy in the world, right? So there's a lot of angry people in this room, right? When you guys come in here, isn't it always angry? Being sarcastic. Yeah. It's always like a really happy place, right? Is that because people got, fibromyalgia and they got gastric reflux and their head's like this and it's forward like that and they're just miserable in life? No, they're loving their life. They're loving their life because they've been reconnected. And that's what happened to Dave Daniels, right? He kind of had, when I first met him, and you know this, Dave, I love you, bro, but he had that poopy diaper face on his face when I first met him, right? He had that poopy diaper face, like he didn't know what he was getting into, all that. Usually the wife has to drag the guys here, and that's what happened. It was one of those situations. She's like, oh, great. You know what I mean? He walks in the door, oh, great, right? He's been a practice member here for 3 years, 3.5 years. Why? Because he knows it's changed his life. He's gotten off medications. He's not on high blood pressure medications like the medical doctors were trying to get him on. He turned all that stuff down. Why was it? Or why did he do that? Because he was empowered with the right knowledge so he could make a different decision about his health. That's why these talks are so important, guys. That's why they're so important. And so Dave sees an employee getting up, and she's like, oh, my God, she can barely stand up. She's got sciatic stuff going on. Which, by the way, another connection. A lot of times we find sciatic issues, the same nerve that goes to the leg, what do you think I'm going to tell you? Goes to the adrenal glands in the lower back. She's got sciatic problems. And he said, well, have you ever thought about a holistic neurological chiropractor? And she gave him the Scooby-Doo thing, right? And he said, well, do you even go to a chiropractor? Oh, yeah, every once in a while when it hurts. And he said, well, have you ever thought about getting to the cause? And she was like, well, I don't know. And then he started to talk about us, said where we were. Oh, that's too far. We have people that drive from Long Beach, Chula Vista, San Diego. Don Love drives from San Diego. Don walked in and he looked like John Wayne. He was on a walker and he was like this. Why was he like that? Because he was miserable. He was in pain. Because he had multiple herniated discs. And what did they want to do to him? Yeah, like multiple segments. They wanted to do surgery, fuse him in multiple areas. The efficacy of spinal surgery is less than 10%. People start getting degeneration above and below, so you look like this. It starts looking like that. Isn't that gross? And it's supposed to have movement. Is it moving when it gets to that? No. Is it going to move any better when we put hard metal on it? No. And then what happens is people start having more surgeries. Pretty soon you're like RoboCop. You're like me trying to dance, right? It's an ugly thing. It's an ugly thing. Ask my wife. Unless it's a slow dance. I perfected that one. So, but that's what happens, seriously, right? That's what happens. You're like RoboCop. You're like this. And you don't want to do that. There's stuff you want to do. Your spine's supposed to be able to move. So Don comes in. He's on the walker. They told him all this stuff. And he's like, man, I hope you can help. I don't know. And I said, and he's like, I'm skeptical. I said, you should be skeptical in the thing that they're trying to get you to spend $250,000 and destroy your life, basically. I'm just here to help you. And he's like, well, I need somebody to fix me. I said, well, I don't do that. Car mechanics do that. I don't know how to fix anybody. But what I do know how to do is work with the intelligence in your body, get that intelligence working right. And what I know, your body's going to heal. It was innately designed to heal. It was innately designed to heal. So we worked with Don, and it was a rough road for Don. Because this is a guy for years. He was referred by Bruce Hoskins, right? He was referred by Bruce Hoskins. Their whole family's under care. Whole family's under care. Like, they got like a platoon. My wife keeps adding. She asked me the other day or today, she's like, hey, you want to add another kid? Which, by the way, if you didn't know, we're pregnant. We're pregnant, so we got another one on the way. She probably hates me for announcing that right now. But she's like, I don't know, 9 weeks or something like that. But she's already asking me about a third one. I'm like, you're so sick, you little New Yorker. We're not even talking about a third one yet. Little Cordie's going to have a sister already. God already told me it's going to be a little girl. No, I don't know, but hopefully it will be. So, but, you know, like, so Don Love's coming in. I don't know how I got off on that, but it was important to tell you. I wanted to tell you. So Don Love comes in. He's on this walker, got all these herniated discs, and it's killing his life force. And he'd been like that for months. He'd been like that for months. Just going around campus. And finally, Bruce Hoskins said to him one day, he said, hey, you know, you should go see my holistic doctor. Here's a gift card. He's going to waive the $350 exam for you, and it's just going to be a $40 administrative fee. And that's a special I run pretty frequently. I'm actually running that special tonight too, because it's not about me charging for exams. It's about me getting people checked. Because I got 4 grandparents that died of cancer. I just talked to my dad today in a nursing home, and I haven't told my wife this yet, but he didn't even know my name. He didn't even know who it was. He's like, who is this? I'm like, Dad, it's your son. And that hit me really hard. I got guardianship of him probably 9 months ago. 9 months ago, I got guardianship of him. 38 years old, I got guardianship of my dad. My mom has several spinal fusions in her upper cervical spine. She lost one of the lobes of her lungs because she got lung cancer. And she can't walk from here to that wall, which is maybe 10 feet, without being totally out of breath. And I've had to cajole her, right? I'm paying for the ticket so she can come at Christmas time. But that's been a whole process. She's been telling me for a year and a half. But I got her to say she was definitely going to do it. So when I talked to her today, I held her to it, right? And she said like 2 weeks ago, she said, I'll call you in 2 days to confirm. It's been 2 weeks. So she tried to do that again. I said, okay, we're confirming it because you already confirmed. So you're definitely coming. I'm buying the ticket, right? But it's crazy what happens when we're subluxated and when life isn't connected. And so Don was going through that. We got Don in here. We started getting him neurologically lined up, right? But we lit him up here before we lined him up on the table. We lit him up here before we lined him up on the table. And we started just edifying him. Your body can heal. It's going to transform. You're capable of that. You can do it. You can do it, Don. It's definitely going to happen. Death and life are in the power of the tongue. Here's some emotional stress release techniques to start doing at home. I need you to do them exactly this way. No different. Exactly this way. I need you to do this many times a day. We'll check you nutritionally after the neurology gets right. But we're going to take that walker and we're going to take it out in my backyard and we're going to burn it or throw it in the dumpster. Don's been under care 4 months. He walks in, he looks like Bobby Brown or something, or MC Hammer. He's like this. Right? He's just walking in. I'm serious. He's walking in like that. His legs, he used to not even be able to bring his legs. This is called internal rotation. You ever see people that walk and their feet are out? That's the way Don was, right? His feet are actually in. He's standing up and walking, guys. He played basketball the other day. Was even talking about basketball. I told his buddy Bruce that referred him here, that's a family member here. Bruce was like blown away. Bruce was almost in tears because of all the results he's had here and was moved by Don's testimony when we told him about Don the other night. This was like 2 weeks ago. That's what happens, guys. That's why it's so important to not only get your spine corrected and adjusted and unsubluxated the rest of your life, but get your friends and family here too. And once we get that neurology right, everything gets better. To include the skin, to include what you can see. God bless you guys. Thanks for your time. Have a great evening.
But the voice of truth tells me a different story.